Luján.
Thank you, Mr. Chairman. Dr. Oz, as I shared with you, New Mexico now has 33 people with confirmed cases of measles. Cases have now spread to a new county in New Mexico. One New Mexican has died of measles, a child. In West Texas, the South Plains of Texas, 223 cases. Child has unfortunately died in the state of Texas. My question is simple. Yes or no, do you believe the measles vaccine is safe?
Yes.
Yes or no, do you believe the measles vaccine is the most effective way to protect against infection?
It is, but if I could mention, as we discussed last night, and I think it's important to remember, CMS really should not be opining its own opinion or sharing its own thoughts on vaccines. Our job is to follow the rules. So if the CDC is making decisions about the use of a vaccine, and that's what's agreed on by the experts there, my job, if it confirmed, is to make sure we pay for those vaccines, seniors and for children.
Now, my colleagues and I have written twice to the Secretary of Health and Human Services to do more to address measles. There's not been a response. The same question asked of you today, if confirmed, would you respond to letters from members of this committee? I appreciate your strong response. Yes. It might surprise the American people that Senator Kennedy or Secretary Kennedy said the same thing. So, Mr. Secretary, if you're watching today, respond to the damn letter. People are dying. I'm going to get back to the questions, Dr. Raj. The next question I had was to ask how many people need to die before the administration takes it seriously. I'm not going to ask you that. But I would like to enter into the record an article from The Atlantic detailing the story of a Texas father who just lost his daughter to measles, Mr. Chairman.
Without objection.
Now, Dr. Oz, I believe Medicaid is on the chopping block because of the Republican budget. And Mr. Chairman, I would like to ask to enter into the record the Republican budget resolution which passed on February 25th, 2025, a letter from the Congressional Budget Office, March 5th, 2025, and an article from the Kaiser Family Foundation explaining the congressional budget letter from March 7th, 2025.
Without objection.
Dr. Oz, I'm going to give these to you because you were asked a question earlier about cuts to Medicaid. Not being aware, and I believe your response was something along the lines of not being aware of what House Republicans did. Here's some material to read that explains what just happened. So I'm going to share this to you as well. That's why I entered into the record. Now, Dr. Oz, rural hospitals are in dire straits. We've heard from Democrats and Republicans today. Now, they rely on Medicaid to stay afloat. Now, yes or no, do you support Medicaid cuts when they will lead to rural hospital closures?
I don't want rural hospitals to close unless we have a better option. But if I could offer a thought here, this is a good example where maybe there's an innovative approach that might work. I have been talking to hospital systems, and one idea that comes up in rural systems is they don't feel like they've got a partner that maybe is a larger academic center or a bigger institution that might have resources for them to do best practices exchanges. So imagine a rural hospital in central New Mexico, maybe around Mesa Verde, where you actually can have a partner that's in Phoenix or Salt Lake City or Dallas, and that could be your partner hospital. So when you need telemedicine services, they're there. They're not just there, digitally. They've been there. They know the institution. They know the people. They develop a camaraderie that allows them to thrive. We have to revisit how we deliver rural care in America. We can't depend on 100-bed hospitals that do one delivery a day to provide state-of-the-art care. So I share your concerns about losing these institutions. I think we should look at additional alternatives to make them strong. But Americans in rural areas, and I have heard it, even in my office visits from every single one of the senators in large rural constituencies.
So Dr. Oz, I'll ask a follow-up to Dr. Cassidy's question, or I'm sorry, to Senator Tillis's questions in conversation. Dr. Oz, will you stand against changes that will lower health outcomes to the programs that you will oversee?
Yes.
Should physicians or insurance companies dictate the care that a patient receives?
I'm sorry,
Should physicians or insurance companies dictate the care that a patient receives?
Physicians.
I appreciate that. I agree with that. Yes or no, will you continue to defend Medicare drug pricing negotiation programs in court?
It's the law. I'm going to defend it and use it.
Yes or no, will you commit to the process of negotiating prescription drug prices in Medicare?
I'm going to look, as the president has instructed me to already, for every single way that we can reduce drug prices. And there are lots of options available. I feel compelled to pursue every one of them.
I'll ask you one more time, because I think I heard it, but I'll give you another chance. Yes or no, will you commit to the process of negotiating prescription drug prices in Medicare?
Senator, it's one of many approaches I want to use.
I appreciate it. I thought you might say yes a second time, but it's not yes or no. So from you, that's fine. Yes or no, do you believe that healthcare decisions, well, I already asked that one, Dr. Oz. Look, as we get through all of this, I have a series of questions that I have put together, not coming into this committee for, based on Senator Hassan's questions. I'll submit them into the record. I have a lot of concerns in these spaces. I won't get to it now. I appreciated having a conversation with you. I'm very concerned of this back and forth of my colleagues saying that they're going to not cut Medicaid or cut it, when Republicans are voting for it. Those are the realities. And as I shared with you, Dr. Oz, one thing that I've learned about Washington, D.C., the way that this place works better is when people keep their word, when people are honest. The American people want honesty. If it's bad news, they'll take it. And they're going to be stronger on how they're going to respond to it. But when they get lied to, and they think something's coming, or they're going to be protected, or a mom with a kid with cancer thinks they're going to have care, and then it gets taken away like that, then what? Just own up. If that's what you want to do, own up to it and admit it. But stop lying to the American people is what I keep saying to all my colleagues, anyone that will listen. God bless you and your family. I appreciate you being here today.
Thank you.